co-insurance for the member. Many people felt those were unaffordable, so the governor's recommending that we put an appeals process in place to allow people to appeal the need. If they must take a third-tier drug, they can appeal that process and get lower costs of the drug if they're approved. Co-insurance. So that's the recommendation of the governor. Many people felt those that financial plan is on page 8. The governor's recommending that. And I just want to point out a couple of things on page 8 for you. Appeal the need if they must take a third-tier drug. If you look in the 2020 column, it's the second column of lower costs. So if you go down about a third, right down to that financial plan appeals the need if they must take a third-tier drug. And I just want to point out a couple of things on page 8. Appeal the need. That's the financial plan. So the governor's recommending that appeals the need if they must take a in-state or out-of-state for approved services would be an 80-20. That's what this proposal is. That's the only difference between the two. Let me show you what that does for the financial one. Match 13 everywhere. All down on the out-of-state on that or out-of-state column, that state fund would be an 80-20. You'll see we're now losing about $53 million. Only difference between those national. And we'll show you what that was. All coverage in-state numbers that were out-of-state. 32 match 13 everywhere. All down on the out-of-state on that out-of-state column, state fund. Let me show you what that does. You'll see we're now losing about $53 million. Only difference. Match 13 everywhere. All down on the in-state numbers or out-of-state column. Match 13 everywhere. Only difference between national. And we'll show you what it was. All coverage in-state numbers that were out-of-state. 32 match 13 everywhere. All down on the in-state out-of-state column. State fund. Let me show you what that does. justice on how losing $53 million only difference between national team and was all coverage in state or out of state. National team coverage in state only difference between national. We'll show you what it was all coverage in state or out of state. 32 national team all coverage in state out of state. Let me show you what that does for somebody else who's got $53 million only difference between national team all coverage in state or out of state. National team all coverage in state only difference between national. We'll show you what it was all coverage in state or out of state. 32 national team all coverage in state or out of state. Let me show you what that does for somebody else who's got $53 million only difference between national team all coverage in state or out of state. National team all coverage in state only difference between national. We'll show you what it was all coverage in state or out of state. 32 national team all coverage in state or out of state. Let me show you what that does for somebody else who's got $53 million only difference between national team all coverage in state or out of state. National team all coverage in state only difference between national. We'll show you what it was all coverage in state or out of state. 32 national team all coverage in state or out of state. Let me show you what that does.
And the employee of the state of West Virginia for the service.
National team all
Like you say now, well, you don't have to have blood drawn, you don't have to do the glucose, you don't have to do this. We had to do it big. And I resented the fact, strongly resented the fact, that I had to use my sick time and my vacation time to go to the doctor because I work on a clock. I'm not like a lot of other state employees that don't work on a clock. The jail authority is down to the minute. Why did I have to use my time? Because you people dictate, you do it, or you have to pay a higher premium. Talk about a bully organization. Good Lord. That I had to use my sick time. I sleep with a CPAP machine. I've done it for 20 years. I went to have a CPAP test, and the woman right across the street, and the woman told me, "Do you have insurance?" I said, "Yeah, I have insurance." She said, "What do you have?" I said, "I got PEIA." She said, "Uh-oh." Why? Uh-oh. She said, "I can't tell you." Why not? Because they don't reimburse me enough for the test. Talk about it. I said, "Well, then what do I have to pay?" She said, "I want $250 for the first test, and if you happen to have a second test, I sleep with a CPAP machine. I've done it for 20 years." Fortunately, I went to have a CPAP test, so I went to the woman right across the street. They provided, and the woman told me, "You have a CPAP?" I said, "Yes, sir." They provided me with a new CPAP machine. Uh-oh. Why? I can't tell you. Along those same lines. Because they don't reimburse me enough. All you need is the headgear and the hose. I said, "You have to, what do I have to pay?" She said, "I want $250 for the first test. And if you happen to have a second test, I sleep with the CPAP machine. I've done it for 20 years." Fortunately, I went to have a CPAP test. So I still have to sleep with right across the street. They provided, and the woman told me, "You have a CPAP?" I said, "Yes, sir." They provided me with. Why does CVS get thrown the bone? Why? And they do get thrown the bone. Along those same lines. Because they're really reimburse me on what you do with it. Private pharmacies don't get you saying the wrong thing. She said, "I was PEIA. And if you haven't done a second test, I sleep with the CPAP machine. I've done it for 20 years. Fortunately, I went to have a CPAP test. Where I still have to sleep right across the street. They provided me with told me, "You have a CPAP?" We don't know why. They provided me with. Why did she get this? Get thrown the
Urge you to stand with all of us together and demand that the legislature fully fund PEIA. Thank you.
Thank you. Next is Wendy Peters, and next will be Bill.
Hi, my name is Wendy Peters. I am the co-president of the Raleigh County Education Association, and I am a fifth grade teacher at Daniels Elementary here in Raleigh County. Thank you all for the opportunity to speak this evening. You know, when we have parent-teacher conferences, we always talk about that we need to talk about the positive first with our parents, so I want to talk about the positive things that I see here. I appreciate that you all are lowering that out-of-state from the 70-30 to the 80-20 and changing those out-of-state services, because I think that's important. I also like that we don't have changes this year in the premium and benefits for 2019 and 2020, and to the appeal process for the prescriptions. That's important, and I appreciate you all doing that. One thing that I would like to tell you all, I know the Healthy Tomorrows is going to be finished, and that you all will be looking at other wellness programs. I think that you all need to make sure that it's not anything that's going to be punitive. I mean, you all know the backlash that you all got from the Go 360. I think we need to make sure that it's not that something that people are going to be punished if they don't participate in. Kind of like a positive reinforcement kind of thing is what I do in my classroom, and I think you all can do the same sort of thing. I do have concerns about that 22% increase that we're going to see here in a couple of years. And I understand that you all just have to kind of work with what money you do have. And I do appreciate that Senator Roberts is here and Delegate Bates. I think that's very important that you all are here to hear what's going on, and I appreciate you all being here. I would hope that other delegates and senators would come, but I would just ask that you all continue to work with the legislature and to continue to work with the task force. I think the task force is doing a really good job. You know, I have friends that are on that task force, and there's a lot of work going into that. But I appreciate your time, and that's all I have to say. Thank you.
Thank you very much. Dale Lee, and then next is John Cusenberry, and I apologize if I'm mispronouncing it.
Good evening. I'm Dale Lee, the president of the West Virginia Education Association, the state's largest teacher organization. And I'm here to speak tonight on behalf of the members of the West Virginia Education Association, the teachers, service professionals across the state of West Virginia who give so much of their time and energies for the kids of West Virginia. My first question, Director Cheatham, in this proposals with the plans, and you show the amount that's needed in a couple of years, does the $100 million that the governor has pledged, that's not showing in that yet? Stay up here, I have several.
Absolutely. That is not.
Because you haven't been appropriated yet, it has
That's
passed the legislature.
That's correct.
So the doom, so to speak, in a couple of years is, if that $100 million goes through, it's not going to be nearly as bad as it looks at that point. But all that does is delay it for a few more years down the road, correct?
Correct.
So it is imperative that we come up with a long-term solution and funding. Now back to the speech. During my tenure as WEA, well, stay there, there's more. During my tenure as WEA president, this really marks a rare occasion. A proposed plan by PEIA that actually returns money to plan participants instead of having to take additional money out of their paychecks to balance the plan. And I commend you for putting forth a plan that will allow plan participants to spend less money on their care. The WEA strongly supports the changes proposed to make the out-of-state care more affordable. My next question to you, the board will decide whether to accept the governor's proposal of border counties or the task force proposal of all out-of-state, is that correct?
That is correct.
And you will do that at the December 20th board meeting, correct?
Correct.
Okay. Well, then I urge you to follow the lead of the task force and to adopt the 80-20 plan for all the out-of-state providers. And as was presented in the amendment that I gave on the task force meeting on Monday, at the end of your 1 year that we really look at the statistics and then help make a decision from that point. And I know you said you already have the data, but the data could be changed as we educate people more about even going out of state. It may cost you more to do that. But unlike some, I do not believe this will hurt the in-state providers, but it will give relief to plan participants in the borders, and they're sometimes required to travel for hours to use the in-state people. That's why I urge you to do that. We also support the reinstatement of the appeals process for the drug formulary. Plan participants should also save money with the ability to appeal the Tier 3 drugs. I commend you for that, and I commend the governor and for you for having that in the plan. Granting these appeals should encourage, and I would hope that very few, if any, appeals that are recommended by the participants' physicians would be rejected. I believe, as most do, that a doctor best knows what treatment the patient has to receive, rather than an insurance provider or someone who's a bureaucrat making that decision. So if a Tier 3 drug is needed, costs should not prohibit the drug from being utilized in their care. We're also pleased that the proposed plan includes no premium increases for actives and retired participants. But we are deeply disturbed regarding the projections for the future years and future premiums. I would hope that the Finance Board would be supportive of our efforts this legislative session to increase plan funding and to make changes to the 80-20 requirement in order to eliminate the need for premium increases in future years. I also want to caution the board regarding any wellness programs that are being looked at. Your proposal mentions the desire to add programs in the future. And like everyone, we all need to get healthier. But the plan participants would welcome programs that assisted in weight loss, improved health, and disease management if they can fit these programs into their life in a manner that fits their schedule, comfort level, and area of residence. Programs cannot simply be a one-size-fits-all requirements. We have to look at our very rural counties and the opportunities they have to join gyms and everything else. So that is an important wellness plan. Any program instituted for participants should be an incentive-based and not punitive. Plan participants will take part in wellness programs of their choosing, but programs forced upon them that penalize non-participants like Go 365 will not be welcome. I also ask that you support the work of the task force and continue as the work to get the statutory changes to improve the cost of prescription drugs, make changes to the 80-20 requirement, and work to find a long-term funding solution. The compensation of our school employees goes beyond their salary. We have seen in the past that health care benefits that continue to take employees' hard-earned money only lessens the already low compensation. It's getting more difficult to get people to take these jobs, and a plan should be all-inclusive, including a total comprehensive plan that is not only health insurance, but the salaries involved. And finally, Director Chief, I want to thank you. You listened to the people, and as we went across the state in the 21 listening tour events in the task force, and when there were things brought to your attention that you could make changes immediately, you did that. And I commend you for that. It was particularly helpful in the Northern Panhandle and other parts of the state. Thank you for doing that. I know most of the time I come up and criticize, but this is a time for us to work together. It's a time for the task force to continue their work. It's a time for the legislature to look at long-term funding. And it's a time for us to put the employees of West Virginia first. Thank you so much.
Thank you. John Cusenberry, followed by Deborah Elmore.
Hello, I'm John Questberry, teacher and a coach here in Raleigh County, and a member of WVEA and RCEA executive committees. Last time I spoke at one of these, I quoted a civil rights leader saying I was sick and tired of being sick and tired, feeling like I was begging for crumbs. Today I come with a thankful heart for the start that has been made. Very appreciative of the governor's and the PEIA board's freeze for another year of the rates, the $100 million surplus that we'll put in, the changes the task force and governors recommended for Alva County, and that you're actually looking at, hopefully voluntary, but looking at wellness programs to try to lower costs and to improve health. I'm also encouraged, usually at these I've seen Delegates Moy, Delegate Bates, and usually Delegate Evans from McDowell County, so I'm pleased to see Senator-elect Roberts here. And one of the gentlemen earlier spoke about the Gettysburg Address. We were just studying that today in history class. And part of that, he said, let us take forward and finish this work that was begun. Reference was made earlier to the collective action earlier in the year and the great improvements that were made, not just for school employees, but for all state workers. And I would like to challenge each of you to be even more involved in this upcoming legislative session as an advocate. I know you have a dual role to protect the finances of the state and the taxpayer, but also to protect and promote the health care and the well-being of state employees. So I would ask that you would make your voices heard, supporting things like a long-term funding solution, changes in the 80-20 language so that the state could put in more than 80% without it being an automatic 20% spread across the employees. I have a couple of questions I was wanting to know. Do you know if the promised 5% pay raise that has been proposed, if that is enacted, if the tiers for the premiums will be adjusted as they were before for employees, so that if raises are given, that won't be taken away in premium increases?
That has not been discussed at this time.
Does the board have a position on that yet?
We do not.
Okay.
We would work on that as the legislation's moving. That would be part of that discussion.
Okay. And the other question, Mr. Lee had already mentioned, so I guess you'll be taking that up, but with the out-of-state, I would hope that you would go with the task force recommendation also. I think that's a big improvement for a lot of our people that live in bordering areas, especially if it's a rural area. The distance can be so great if you're having to go to Charleston or to Beckley or Princeton, one of the few Morgantown areas. The other thing I was wanting to know is, are there specific cost-saving plans that the board is currently looking at? I know you've mentioned some of the wellness programs possibly, so that we can work on lowering the costs rather than in a few years getting back to where we were, where it's all balanced on the workers and the patients. Are there things that are currently being discussed? Like I saw where you said the new contract with the healthcare provider. And I think that's great. Are there ways that we can pull resources maybe with other states to try to get contracts with lower costs?
We're looking at all those things. We're right now going out for a market check on CBS to verify we're getting the best drug rates that we can get in the market. That's going on now. We just got RFQs in from a consultant to help us with that project. We just redid the Humana contract, as you know. We just released our TPA contract, as you know. And the thing that probably is next in line is to help get the workforce healthy. That's the next way to help control the costs in the way.
And I appreciate that you are trying to put effort into the preventative side to lower the costs. Anything, I would just ask that, I know at some point, there's only so far that you can go with money available, but to try to tip the scale as much as possible to the preventative and what we can do to manage and contain costs rather than always looking at the raising. I'm very encouraged and thankful that you said we're going back to like we were a couple of years ago, restoring benefits that were there. So thank you for the work you have done. As I said, it's a great start. And please make your voices and your influence heard in the legislative process, along with all the state workers. We would appreciate that greatly.
Thank you so much. Deborah Elmore. And then Linda Boyd.
Good evening.
I'm Deborah Elmore, member of AFT and president of South Central Labor Council of the West Virginia AFL-CIO, which represents 5,300 union members in Fayette, Raleigh, Summers, Mercer, Wyoming, and McDowell counties, many of which are teachers, service, and public employees. Now, normally at this time, I have a prepared speech. I know you and I have gone through this for many, many years, and I'm not going to keep repeating what I've been saying for the past couple of years. You know, it's been many, many years that we've been here. So, I'm going to turn my back for just a second. Senator, I'm glad you're here. I have a request, and if Mick's still here, he's heard this request, Ricky's heard this request, find us a funding source. These people can't do their jobs without the funds. Find us a fund. I'll say what I said last year. You know, there's pipes going down the road every day, and there's going to be oil and gas going through those pipes. Help us. Thanks for what you're trying to do. Thanks.
Thank you. Linda Boyd and then Kevin Burrows.
Hi, I'm Linda Boyd. I'm the president of AFT here in Raleigh County, and I am a teacher at Shady Spring Elementary School. Everyone has pretty much said what I think everyone came to hear, is that we really are looking for your support, and when we go through this legislative session, we do need the funding, we do need help. We all know, we could talk about the elephant in the room, which is the severance tax, but I'm not going to go there. I'm going to talk a little bit about myself, my personal issues that I have with the wellness programs. I am a diabetic. I was diagnosed several years ago and went through denial for many years because I thought, I'm the fat girl, I can't control myself. And so I did finally go on to medications, and I have gone through face-to-face program, which is a wonderful program. I also commend you on that, but it no longer exists. And it lasted 2 years, and now I'm done. And for those of you who don't know what face-to-face, that's PEIA. You go through exercise programs, and you work with a pharmacist, and you have a consultant with your, what is the word I'm trying to say?
Physiologist, exercise physiologist?
No, the food. The dietitian, thank you. So you have a dietitian, and then PEIA covers your diabetic medications, which is a really good deal, but it only lasted a couple of years. And so I also went through the program so that I could, the weight loss management program, and that was also excellent. My goal was to go through bariatric surgery, not because I think that I want to lose a lot of weight, but that would definitely be an advantage, but because 80% of the people who go through that surgery go into remission of diabetes. And I've gone through bouts of depression with diabetes, with having to give myself up to 6 shots a day. And now I'm on 3 different medications, and I've added up the cost of those medications. I went through the program. I went from 230 pounds to 192 pounds. So that's that. But that wasn't enough. But if I go through the program again, I will have lost too much weight to have that program work for me. So I added up the cost of all the medications, and the cost of the surgery would be less than 1 year of medication. And if I had that surgery and I went into remission, I wouldn't have to pay for medication year after year after year, because I do plan on being around a few more years. So I just wonder what you guys, when you look into those programs, are you really looking at the final cost or what it's costing at the, I'm looking at you to look more deeply into the outcome of what could happen that's all I have with that. I just, like I said, 80% of the people who have that surgery go into remission. And then if they don't go into remission, 15% more at least lower their amount of medication that they need. So that's 95% better outcome from having a surgery. So I just want you to take a look at some of those when you're looking into the wellness programs. Thank you.
Thank you very much. Helen Gross and Nicole McCormick. Is this on? Helen Gross. Oh, she's on. Okay. Nicole McCormick. And then Jessica Morgan.
Good evening, everyone. I am a mother, a veteran music teacher, and the local education association president in Mercer County. I'm here this evening to speak to you not only as an individual, but as a representative of our nearly 500 members in Mercer County. As an individual, I have 4 small children. They're 7, 5, 2, and 2, a spouse that also teaches, and I struggle with depression and anxiety, which means that I must take medication to function like a normal adult. I can also tell you that I currently struggle to pay my medical expenses, including the cost of that medication. Even without any current or future your proposed increases to premiums, medication costs, or co-pays, my family is nickeled and dimed to death. We currently cannot afford to pay the $50 copay per person at MedExpress. MedExpress is a necessary evil because medical facilities are few and far between in southern West Virginia. And they keep regular business hours, which means in the unfortunate event that someone is sick enough to not be able to wait till the morning, we have to cough up that copay. And you know, children get each other sick, they're kids. We cannot currently afford the $100 copay for emergency room visits, heaven forbid. And honestly, most weeks we can't even afford the $20 copay for our general physician, if you're lucky enough to get in, because so many people have shuttered their doors. And that's most weeks, but that $20 is too much. Between our low salaries, and I've been teaching for 10 years, I have a master's degree, my husband's been teaching for 12, has 2 master's degrees and is finishing his doctorate. So I mean, it's not that we're uneducated or we haven't tried, or that we don't do extra stuff. I teach voice lessons, my husband does after school detention, teaches for Concord University, adjunct, and for Whitfield Community College, and we still struggle. Between our low salaries and the ever-increasing healthcare costs, we are drowning. And can you imagine how much a full-time cook making $19,000 a year is struggling to afford health care? We are becoming ever closer, every legislative session, to the precipice of not being able to afford to stay in our home. Last year, I attended the PEIA hearing at Tamarack, and I listened to a teacher very similar to myself, a man in his early 30s with a spouse and kids. And this man clearly and boldly told the board and the folks in the room that at the end of the school year, he was leaving West Virginia to work in another state so that he could afford to have health care and provide for his family. So my question to everyone in this room, not only you, but legislators that are here, which none of the Mercer County legislators are here, our delegates, by the way. So my question to all of us is, who suffers when educators, and by educators I do mean teachers and the essential support professionals, cannot afford to stay? Is it just the teacher? Just the cook? Just the aide? Maybe it's just the secretary or the bus driver? No, it's West Virginia's children and the future of our state. You may have no control over our salary, but you do have influence over our healthcare costs. And our healthcare costs are directly tied to our ability to afford to live. The many Mercer County Education Association members I stand here to represent have suggestions you can give to the governor and West Virginia legislature. The first one is to change legislative language to the state covering at least 90% of upfront PEIA costs, and West Virginia public employees pay no more than 10%. The use of progressive taxation to fund raising healthcare costs and to offset the burden on West Virginia public employees. And these taxes must never be put on the poor and working class West Virginians. And those progressive revenue suggestions are increasing the gas severance, increasing the business tax, and even creating a wealth tax of 3% on households making $200,000 or more a year. We, the educators and public employees of West Virginia, work hard, well beyond our workday and job description, to serve the children and families of this great state every single day. We need our state government, our legislature, and our PEIA board to support us in many ways, including making our healthcare affordable, accessible, and top-notch excellent. Unfortunately, last winter, it took drastic measures for our elected representatives to even pretend to listen to us. After years of begging and emails and phone calls, they, the legislative body, have done nothing to curb our struggle to stay. So we need the PEIA board to advocate on our behalf for affordable quality health care. I do appreciate your work as well as the work of the task force, and I appreciate your time, and I'm trusting you as an individual and as a representative of so many people to take our suggestions to the folks that can make legislative change. Again, we appreciate you. Thank you.
Thank you very much. Jessica Morgan. And Jessica Morgan, you're the last on the list, so if there is anyone else who's made a decision they'd like to say something, please let us know after Jessica's finished. Thank you.
I'm Jessica Morgan, and I'm a former teacher, and I currently work for the West Virginia Education Association, and I spend the majority of my time in a region that has over 100 schools, and so I talk to teachers all the time, and I talk to service personnel, and I hear the things that they're worried about with the new plan, and I have a few things to share with you today on their behalf. Their number one concern is that there's still no funding stream, and they do understand that, you know, tonight at this meeting, I'm not speaking to the legislature who does have the power to find that, but since that's the number one thing they're worried about, I can't ignore it. So to that issue, it is scary. They see on your plan the upcoming increases as the years go by, and that is the main thing. Now here are some of the other concerns. They would like to make sure that the appeals process for the Tier 3 drugs isn't something that is so tedious that they end up running out of the medication. They want to know more about how that works. Some people are a little wary of that. I have one of my members, for example, has a son who needs a Tier 3 drug because he has reaction to the generic forms, and it goes from being, you know, $20 or $30 a month, jumps up to, you know, several $100s a month. And so not only is that something they can't afford, but they also can't afford for him to run out because of having to jump through hoops with paperwork and things like that. So that was another big concern. Flexibility in pharmacies. There are some very rural places, like for example, Pocahontas County. I think they have 3 pharmacies. It might be 2, but in the whole county. And so, where I think CVS, correct me if I'm wrong, they're supposed to go to CVS or an approved place, but just consider the area, like what they have there. They might not be able to drive an hour to get to a pharmacy that will serve them. And please continue to protect and respect the retirees. They are not getting, they're not getting raises. Their income is fixed, and so the retirees I've spoken to really appreciate that their rates are staying the same, and they hope that we'll all stand with them and help them out because they worked hard their whole life, and they don't want to
live through their retirement struggling and having to go back and get another job when they've already worked their whole life, so. And I think that's all I have, but while I do have a platform for a minute and some people here listening, I just want to say please for everyone to pay attention during the legislative session, because even though we do have some great things happening with the plan that you've presented, and we're very appreciative of that, this isn't the last stop, and we need for a funding stream, and we're going to need everyone to pay attention and make sure that we get the funding stream so that down the road we don't end up playing catch up for hundreds of millions of dollars that are needed to make up the costs. Thank you.
Thank you very much.
Well, I should say something. Thank you for what you're doing.
Would you introduce yourself for the?
Appreciate that. Senator Roland Roberts, representing District 9. So this is home, okay? This is home. Thank you for what you're doing. And if you'll accept my apology for a moment, I'm going to address the folks. I am in my 31st year, right here in Beaver. I'm cut from a different stone. I come from a different perspective. I've pastored for 42 years. The lady who spoke earlier, I'm one of the ones who keep people like you going with the counseling and the prayers and the encouragement and the help. I've been placed in a position of leadership to represent you. I suppose I'll be like I've always been, not too quiet and very curious. I expect to be given leadership opportunity, but I'm brand new. I hope to never be called a politician. Please don't insult me. I hope to become a statesman, because some of those legislators need to be preached at. Amen?
Amen.
Okay. Now, I want you to know something, that my thinking processes come from an outsider looking in for many decades. I process things differently than somebody who has been inside for many years. I think new eyes and a new viewpoint may hopefully breathe some new life instead of the old energy keep replaying. Aren't you getting tired of the same old, same old? Okay. It's what I've witnessed. It's what I see. Now, I won't be given leadership opportunities as a new guy in the chamber. I don't expect that probably they will want anybody to question anything. And I have to balance that thing out, because I know if I go in and become a renegade, then I'm not going to get anywhere. So I don't know how that is all going to play out, but I have, as my Heavenly Father guiding me, I think I have divine intervention in what's going to take place. Now, I don't know what the future holds, but I will tell you that I have people. I employ 17 teachers. I've been in education for 42 years. It's been on the private side. We've had to exist without favor and not taking government funds at all. And that hasn't been an easy thing. That doesn't make us on different sides. Aren't our children West Virginia children? Don't we care about West Virginia families? The answer is, of course we do. And I care probably more than most that you would find. Because not only have I put myself out there, but I have continually tried to be a help in the background. Now I'm going to be in the forefront. You're going to hear Senator Roberts a few times. I don't know where all of those things are going to lead, as I said, But I will tell you that the people that I have pastored for all of these years and continue to pastor, that are teachers, that are retired teachers, the senior citizen centers that I have very many friends with, that I've known down through the years, that I go in there and they know who I am, we're on the same page. I care. I think that probably is the most important thing you need to hear tonight. I care. Now, what I can do, find the funding source. That was the request. That's been a request for years. I will tell you, I have no fingerprints on any lies, any deceits, any misrepresentations of the past. And I've told my people, keep my feet on the ground while I'm in that place. I will do my best. And that may not be easily communicated all of the time. But I want you to know that my heart is in it for the final results and the long-term results. Fix it. Fix it. I don't know how to fix it right now. But my antennas are up. And you better believe that I will be one of those voices on the inside saying, look, let's help these people, because these people are who I am. I pastor them, I counsel them, I marry them, I bury them. And I'm involved on a daily basis. Now, there's another avenue, totally new direction. And I just want you to know tonight who I am in my heart. Because if you're not careful, you're going to stereotype me and you're going to pigeonhole me. And we're not going to be able to make the progress that we need to make on behalf of our state, but especially on behalf of Southern West Virginia. But we're struggling. They tell us that there are 8 counties carrying our state right now with this surplus. 8 counties. Do I need to tell you that none of them are in Southern West Virginia? We kind of know that, don't we? We're struggling. We're all struggling. There are issues that need to be addressed. I'm one person, one voice, and I'm brand new. But I will tell you just in closing that this week alone, I was there at the Capitol. I've been in Charleston all day Sunday. When it started snowing hard and I knew we couldn't have church services, canceled church services, and I headed to Charleston. Spent the night. Was there all day Monday. Came home Monday night. Went back on Tuesday. There all day Tuesday in meetings. Trying to learn, trying to listen. Because I want to get in there and make a difference. I'll be there tomorrow. No, I'm not getting paid anything. I'm trying to do what I have done all of my life. On your behalf. I haven't met most of you. But I suspect that some of us will get quite acquainted in the next 4 legislative sessions that I'll be privileged to serve in, at least. And I say at least because I expect I've probably got about eight years in me. And then I'll term limit myself unless there's, for some reason, something's changed. And I don't know that. I'm not limiting that. Don't quote me on that, please. I don't know. But anyhow, I thank you. Thank you for your kindness. And I just want you to know who I am from this format. And I thank you all for giving me an opportunity to speak. Thank you.
Thank you. Was there anyone else? Sure. You could introduce yourself.
Good evening. I am Kevin Green. I am the local AFT president in McDowell County, and as such, I am also a teacher in McDowell County. I come representing myself and my members, and I want to thank you for the plan that you have put forward. There are many great changes that I believe that we'll see, and I do think that they benefit the public employees in West Virginia. I want to talk to you specifically about the recommendations. As you're aware, McDowell County is a border county. And many of my members either live in a border county or they live on the border. And when the benefits were reduced to individuals seeking medical treatment in border counties, that negatively affected a lot of our members. In many cases, many of our members were already dealing with situations with current medical physicians, and because of the changes, they had to take their treatment back inside the borders of West Virginia for various reasons. Well, that's easier said than done. For some of them, those living on the border, they would simply go on, 15 minutes down the road into Virginia and be able to get the medical treatment they needed. But after the change, they now had to drive to Princeton or to Beckley or to Charleston. And in either direction, that's at a minimum of about 2 hours. And if you are working every 5 days a week, that's going to be an even a larger burden on them. And so I'll come to you to urge you to adopt the recommendations that the PEIA task force has put forward, all of them, but specifically I want to talk about returning coverage to border counties. Senator, you represent part of my county. You and I will get to know each other quite well over the next legislative session. I look forward to working with you, and I thank you for your open mind. You may be a novice at legislating, but don't sell yourself short. You still have a voice. Your people elected you. They elected you to represent them, and they elected you to try to help solve their problems. So I ask that you use that voice. Do not be afraid to speak out against the majority, if necessary, if you feel compelled to do so, or if your constituents ask you to do so. Remember, I ask that in all of your time, whether it be 4 years or 8 years, I ask that you conduct yourself as a delegate and not necessarily a trustee. The two terms are different. To be a trustee, it is seen as a transfer of power from the constituency to the representative, and the representative would be to decide what is best. The delegate is to represent the view of your people and to vote the will of your people. I ask that you stay in constant communication with them, and I ask that you remember that a state senator is a delegate, and that you take that philosophy with you. And again, I look forward to working with you, and I ask that you use your voice when needed. Do not be afraid just because you are a novice to do so. So again, good luck, and I thank you for your words and your willingness to listen. And again, I look forward to working with you. Back to the board. Again, thank you for the proposal. I strongly urge that you will adopt the recommendations that the task force has put forward, because it will ease the burden on public employees. And as has been said in this meeting this evening, the teacher shortage is quite tremendous in this state, as it is across the country. And McDowell County knows that problem all too well. And when teachers' benefits or school employees' benefits, I won't just limit it to teachers. When school employee benefits are decreasing and it becomes more of a burden, and the salary is already much lower than a surrounding state, the incentives to stay here are not there. And West Virginia students deserve a quality education just as much as a student in Virginia. And your willingness to take up those recommendations and to adopt them will continue to show your support to the students in West Virginia by trying to attract quality teachers. And so I thank you for your time, and I thank you for your consideration.
Cheatham typically hangs around these things to answer any specific questions, so I'll volunteer him to do that right now, without his permission, but he is very good at solving problems, as was mentioned earlier, so if you do have an individual question, don't hesitate. Thank you very much.
Bye, guys on the phone.